When evaluating this patient, when they came in and, finding these things, the co-infections, everything, was there anything that stuck out to you that would be different than the pattern of what you see in most Lyme patients? Or was it very similar?
It was pretty similar. I
Was.
will say something for her that we found that might be different is issues with allergies and the way her immune system was recognizing meat. Specifically for her, it was actually grains because, all animals are eating grains essentially.
Yes.
So we worked on allergy elimination for grains for her. And I think it was the whole approach and the whole picture that ended up helping her, but that was what was pretty different from her and other Lyme patients.
Interesting. And that was, did you guys go about NAET for the allergy elimination within the comprehensive program of treatment that was added in?
Yeah, through starting during detoxification for her because it was also creating a blockage within this patient's nervous system. So
Mm.
when we do identify allergies with patients, we often detoxify them first and then address
Mhm.
it after. But for us within detoxification, we're also trying to regulate the nervous system. So we would struggle to do that if we weren't then working on the allergy of this patient. So she had 3 sessions of, NAET just to work on grains. And that's all she ended up needing for that, which is relatively easy when you think about what she might have gone through for who knows how long. But yeah, that was a major difference for her. And I do believe a big help in her, being able to return to normal eating patterns.
I know for most Lyme patients, and you could talk about this specific case with the alpha gal, of course, everything's personalized and tailored, but you have these patterns that go along with it. And the pattern, as you mentioned, starts with this detoxification, improving of the terrain so that
Mhm.
it's easier to go after any microbe or pathogen there. And then you go into this antimicrobial phase where you're trying to target all co-infections in different ways. And then finally, a regeneration, emotional energy balancing, all the extra pieces at the end. Did you see the same patterns in this case with the alpha gal associated with Lyme?
Yeah, she did. Aside from the allergy elimination, I would say it was pretty on par with the rest of the Lyme patients we've treated here. They always have some, it's personalized, so they do have variations within, what type of compounds we're putting in their IV bags, where are we working on their nervous system regulation, where are we finding disturbance fields on this patient, and then, their supplement protocol as well is very much tailored to the patient. But she did follow a pretty, for lack of a better word, normal course for our Lyme patients here.
I'm curious because you have a young patient that was, I understand, relatively healthy prior to this tick bite, correct?
Mhm.
Prior
Yeah.
to the alpha gal diagnosis and the Lyme association. What was the level of toxicity? Because that's always a really interesting piece there. We do it a little bit differently than, let's say, urine provocation or anything. We're
Mhm.
looking interstitial using Dr. Schimmel's biological index on a scale of 1 to 21, 1 being incredibly clean terrain, 21 being pretty, nasty and very, very toxic terrain. What was she at?
So she was high, especially for her age. She was at a 16.
Okay.
When a patient starts entering that like 13 to 16 range, it's showing us they definitely have a very high amount of inflammation now going on in the
Hmm.
body. So it's probably been happening for a certain amount of time, not like a relatively recent issue. And she was on the borderline. So when they start crossing over 17 to 21, they're starting to enter a degenerative type of process. And that's when you're looking at a lot of the more scary type of diagnosis. So she was right there. I think she came at a really good time because it was relatively easy to treat her with everything she had going on, but she was definitely progressing into more of a severe place in her health.
Yeah, no, we definitely got there at the right time. So it didn't go into those very high levels where it starts to really do damage throughout the body that could be lasting in some ways and require more regeneration afterwards.